does this turn into something actionable right now, or is this just something that we'll have to wait and see whether it actually becomes the law of the land or the law of the insurance marketplace?
This is just exactly an executive order. In order for any of these changes to be implemented, there needs to be a whole rulemaking process through the federal government, and that's a process that could take weeks and months to unfold. So nothing immediate, but the outlines that the president has announced are important in terms of both signaling his intention and kind of a tertiary effect, which could be immediate, which is the potential to have a chilling effect on signups for the Affordable Care Act heading into the enrollment period, and the prospect of pulling healthy people out of the existing system and into these new systems. So to that extent, you could have a market effect. The actual effect in terms of options, alternatives that folks could have to sign up for, it's going to take some time still to unfold.
So let's get into the details a little bit and talk about relaxing standards for association health plans, also short-term health plans. What's the order saying exactly?
Well, it would allow for these association plans, smaller businesses to kind of band together to give them new insurance options that exist without some of the restrictions of the Affordable Care Act, but also without some of the protections for patients of the Affordable Care Act. So if you're young and if you're healthy, or if your insurance under the Affordable Care Act is so expensive that you just feel that you can't afford it, this may give you some other options, but don't look for those new options to include the same protection. So if you have mental health pre-existing conditions, if you need maternity coverage, if you have other pre-existing conditions, they may not be covered under kind of the new rules that would be envisioned that are being discussed. So there's that issue. There's the issue of tax shelters for healthcare expenses. That'll be very popular. And these are just some of the issues. But again, one of the big questions is not whether it creates new alternatives for people who want some short-term plans, some portability, but whether it takes away effectively that option of getting insurance under Obamacare if, despite the expenses, you still feel that's the coverage that you want.